Hello, I'm Arden Birney, one of the authors of Scope of Practice Review, Providers for the Assessment and Triage of Spine-Related Disorders article. I will be giving you a brief overview of our publication. Almost everyone will experience back pain during their life. When experiencing low back pain, most patients seek initial help from their family physician. Some may consult chiropractors or physiotherapists to ease their pain. Back pain can be very debilitating and creates enormous cost to the healthcare system. However, it is not always clear what the best treatment approach is and the best healthcare provider to consult with. And when specialist care is required, it is often difficult to see one because of the long wait times. There has been great interest in creating new service delivery models with clearly defined guidelines that improve access and better coordinate care. Some research has demonstrated that triage systems, where non-physicians do the initial assessment and triage, can reduce wait times and improve outcomes. The Bone and Joint Health Strategic Clinical Network is a network of researchers, practitioners, planners, and patients in Alberta, Canada, working to transform how we deliver spine care. The network aims to improve spine care by designing a new interprofessional, team-based model of care. An important component of the new model is a centralized interprofessional triage and comprehensive assessment system that draws on the knowledge and skills of a range of healthcare providers. We examined the scope of practice of healthcare providers who commonly treat patients with low back pain. We wanted to understand how these healthcare providers are trained, the treatment approaches they use, and the regulated activities they can perform. We examined the scope of practice regulations for 11 professions in Alberta. We also interviewed 17 practitioners and administrators from these provider groups to better understand the role each type of healthcare provider could play in the triage, assessment, and treatment of low back pain. From our data analysis, we found that we can group the providers into 3 categories. Group 1 consists of family physicians, nurse practitioners, registered nurses, licensed practical nurses, and registered psychiatric nurses. These providers have a broad skill set and appear most suited to complete an initial comprehensive assessment for patients with nonspecific low back pain. The second group consists of providers that are best suited to complete a musculoskeletal assessment and triage. These include chiropractors, occupational therapists, physiotherapists, and athletic therapists. All of these providers have extensive training in spine assessment and rehabilitation. They are more suited to do more detailed spine assessment. The third group consists of psychologists and paramedics. These providers could provide complementary services and support depending on individual patient needs. Studies show that back pain and psychological distress are highly correlated, and that appropriate assessment for psychological yellow flags leads to more positive outcomes. The findings from this study tell us that a wide range of healthcare providers could be used to establish an interprofessional assessment, triage, and treatment model for patients with low back pain. The study highlights that some professionals that are typically not included in healthcare teams, such as chiropractors, could play an important role. Not having to rely on physicians and specialists can help patients to get quicker access to care and improve their outcomes. This can also reduce overall healthcare costs. Despite these positive findings, we have to realize that implementing team-based models of care can be quite difficult. We identified several obstacles resulting from legislations, policies, funding, and lack of awareness of provider skills and knowledge that limit these providers from working to full scope and prevent successful integration. Further research on how to implement and use these teams effectively is also needed. We would like to thank those who contributed to this research.